Smallpox, from global disaster to public health triumph. I'm Tamara Paget. Smallpox, one of the deadliest diseases in human history and one of the greatest successes in global public health. For thousands of years, smallpox caused widespread illness, death, and social disruption across the world. However, through scientific innovation, international cooperation, and coordinated vaccination efforts, it became the first, and so far only, human disease to be completely eradicated. In this presentation, I'll explain what smallpox is, why it was so devastating, how the global eradication campaign succeeded, and what lessons it continues to offer for global health today. Smallpox is a highly contagious viral disease caused by the variola virus. There were two main forms, variola major, which was much more severe and had a mortality rate of about 30%, and variola minor, which caused milder illness. Symptoms usually began with a high fever, fatigue, headache, and body aches before a distinctive rash developed. The rash progressed into fluid-filled blisters and eventually formed scabs. Survivors were often left with permanent scars, and some experienced blindness. Because of the severity and ease of transmission, smallpox remained one of humanity's most feared infectious diseases for centuries. Dr. Henderson was a world-renowned smallpox expert and wrote a book about the disease. He proclaimed that smallpox has existed for at least 3,000 years and affected civilizations around the globe. Historical evidence suggests it was present in ancient Egypt, Asia, and Europe long before modern medicine. In the 20th century alone, the disease is estimated to have killed between 300 and 500 million people worldwide. And as you'll see later, the disease was eradicated in 1980, leaving 20 years of the century still uncounted. Beyond the loss of life, outbreaks overwhelmed communities, disrupted economies, and influenced the outcomes of wars and migrations. Smallpox spread primarily through prolonged face-to-face contact via respiratory droplets, though there is one noted case of airborne spreading. But it could also be transmitted through contaminated bedding, clothing, or other materials used by the infected individual. After exposure, people typically experienced an incubation period of 7 to 17 days before symptoms appeared. Once the characteristic rash developed, infected individuals became highly contagious. Unlike some diseases, nearly every infected person developed visible symptoms, making it easier for public health officials to identify cases and isolate patients. During the 1763 siege of Fort Pitt, British officers discussed and reportedly distributed blankets from a smallpox hospital to members of the Delaware Nation. While historians continue to debate how much this specific incident contributed to the outbreak, it is recognized as one of the earliest documented attempts at biological warfare. More broadly, the introduction of smallpox after European contact had catastrophic consequences for indigenous peoples throughout the Americas. Without previous exposure to the virus, many communities lacked immunity, and some populations experienced mortality rates estimated at 50 to 90%, leading to profound demographic, cultural, and social losses. In 1796, English physician Edward Jenner made a groundbreaking observation that people who had contracted the relatively mild disease cowpox appeared to be protected from smallpox. He tested this idea by inoculating a young boy with material from a cowpox sore and later demonstrating immunity to smallpox. Jenner's work laid the foundation for modern vaccination, and the word vaccine comes from the Latin word vacca, meaning cow. This discovery transformed medicine and eventually became the cornerstone of smallpox eradication. In 1967, the World Health Organization launched the Intensified Smallpox Eradication Program. Rather than relying solely on mass vaccination, the campaign emphasized surveillance, rapid reporting, and a strategy known as ring vaccination. Whenever a case was identified, healthcare workers quickly vaccinated close contacts and surrounding communities to stop transmission. This targeted approach proved highly effective, especially in regions where vaccinating entire populations was difficult. International cooperation, local healthcare workers, and community engagement all played critical roles in the campaign's success. Smallpox possessed several characteristics that made eradication possible. Humans were the virus's only natural host, so there were no animal reserves where it could continue circulating. People did not spread the virus before symptoms appeared, and the distinctive rash made cases relatively easy to identify. In addition, the vaccine provided strong and long lasting immunity. Combined with coordinated international surveillance and rapid response, these factors created conditions that allowed transmission to be interrupted worldwide. This map illustrates how smallpox gradually disappeared from country after country during the World Health Organization's eradication campaign. This wasn't because every person on Earth was vaccinated. Instead, they used the ring method, which we previously talked about, surrounding each case with vaccinated individuals until the virus had nowhere left to spread. While mass vaccination was important, the campaign's success depended on getting vaccines to people who needed them the most. The WHO partnered with national governments, local healthcare workers, and international organizations to transport vaccines to remote villages using trucks, boats, motorcycles, and even animals when roads were unavailable. A major ground breakthrough was the development of the freeze-dried vaccine, which remained effective without continuous refrigeration and could withstand transportation in hot climates. Another innovation was the bifurcated needle, a simple, inexpensive tool that required only a small amount of vaccine and made it easier to vaccinate large numbers of people quickly. This targeted approach stopped outbreaks more effectively and played a critical role in eliminating smallpox worldwide. Although smallpox has been eradicated, it remains relevant today. Official virus samples are retained in two high security laboratories for research purposes. Because routine vaccination ended decades ago, much of the global population no longer has immunity. As a result, governments maintain emergency vaccine stockpiles and preparedness plans in case of an accidental release or intentional misuse of the virus. The history of smallpox also continues to influence strategies for responding to emerging infectious diseases. Smallpox remains one of the greatest achievements in public health history. It demonstrated that effective vaccines, strong surveillance systems, and international cooperation can successfully eliminate a devastating disease. At the same time, it reminds us that eradication is extremely difficult and depends on the biology of the disease, available tools, and sustained political commitment. The lessons learned from smallpox continue to inform efforts to control diseases such as polio and strengthen preparedness for future global health threats. Ultimately, smallpox shows us that when nations work together, remarkable public health achievements are possible. And here are my references. Thank you so much for listening to this presentation today.